This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right. Well, thank you very much for the introduction. I'm Casey Smith. I'm the program director at the University of Kansas. I am now entering my second year as program director. Give a little bit of background about our program. I'd say it's a mid-sized program. We are typically advanced standing with an association with internal medicine, to where residents can do an intern year, but technically I think we have a total of 12 within our program. And looking at kind of doximity rankings, where we've been kind of 25 to 30 over, or 23 to 30 over the last 3 or 4 years. Very strong in multiple aspects. We've got a NAS fellowship associated with our program with 2 spots. We also have a pediatric fellowship with an association with Children's Mercy Hospital. We have multiple sites, including at KU, as well as Rehab Hospital Overland Park, the VA in Kansas City, as well as Eastern Kansas VA, and as I said before, Children's Mercy. Some of the things that I would say make us a little bit unique. One is we have the ability for a research track, to where there is support in both time and funding for 1 resident per year to be able to do research. Another is the ability to do electives. We try to make a priority, and one of the things that we're looking at doing is being able to do electives even earlier within our program, as early as PGY3. And one other thing that we're looking at kind of doing for the program that we haven't done yet, but is on the horizon for the future, is honestly to be able to do EMGs and more exposure as a PGY2 level. So some exciting stuff on the horizon. And I've said many times before, I feel great about our residents and our chief residents that are with you tonight. Dr. Zhang and Dr. Levitt are among the best in the country. One thing I forgot, and I was going to say that also is unique about our program, is global health certification, which Dr. Levitt is our first member to be able to do, as he has gone overseas to work and earn his certificate. So a lot of exciting stuff in our program, and I'll turn it over to Dr. Levitt. Dr. Zhang.
Awesome. Thanks so much, Dr. Smith, for starting us off. I'm going to get some slides shared. Thanks to PM&R Scholars for allowing us to be here. I'm really excited. One of our alumni, Vinny Francio, actually helped start PM&R Scholars, so we've always been excited to help out and participate. Just want to make sure, can everyone see my slides? Sharon, can you see them?
Yep, we're
Cool.
good to go.
Awesome. Well, we'll get started now. So I'll share a few slides, and then Sharon will jump on. We'll have a few minutes for questions, and feel free to hop in the chat about any questions that come up. All right. So this is a picture of the University of Kansas Medical Center, our main campus. You can see a couple of the new buildings, kind of that one towards the back left. It's our new building called the Cambridge building. We do a lot of consults and see a lot of patients there. And you can see a sliver of our rehab hospital on the very far right, that little tan building on the very far right across that street. That's our main inpatient rehab facility, where we spend a lot of our time, especially as PGY2s. But the medical center is very accessible. You can just cross that street, and then you're inside the hospital. You can all access all the buildings inside. So really nice setup there. Just a little bit of our program leadership. You guys already met Dr. Casey Smith. He's our residency program director. He focuses primarily in interventional spine and musculoskeletal medicine. And then we have Dr. Eriks, who is our associate residency program director, and she's board certified in PM&R and in brain injury medicine, and also does some general neuro rehab. And our awesome coordinator who makes our program run, Sarah Jorgensen. If you interview with us, you'll get to meet her, and she's super nice and approachable, and keeps us well fed and keeps things running smoothly. A little bit about our program. Our residency program is established in 1944, actually. So it was one of the earlier programs. It was established by Dr. Harry Wall, along with some of the other programs in the Midwest and the East, like Mayo, Mass Gen, Cleveland Clinic, University of Minnesota. KU kind of fell in line with them. Like Dr. Smith said, we are a 3-year advanced residency program. We have 4 residents per class, so 12 total. And like you said, there's 1 to 2 positions available in internal medicine. So those that match or that interview with us can definitely look into that option. I think in the last 2 years, we currently have, I guess, 2 current interns that are with the internal medicine program last year, 2 last year, year before that, and then 3 actually the year before that. So a lot of opportunities if you interview here to also do your intern year here. And we also try to integrate them into different activities and wellness events and didactics if they're on off service or whatever, to try to really get them involved in our program early on too. Some of the specialties and experience, like Dr. Smith said, we're working on a few different things and getting some earlier exposure and earlier opportunities for electives, but you'll get all the main parts of PM&R, all the different specialties. We have 3 main inpatient rehab experiences: stroke, brain injury, and then spinal cord injury. And you'll get exposed to spasticity, amputee, P&O, all those types of things in different outpatient clinics. And then just wanted to make sure, I know a lot of people always ask about kind of event coverage and sports medicine coverage. There is that availability if you're interested in that. Procedural exposure, like Dr. Smith said, we are working on getting some earlier EMG experience, but even then, like we do a lot of them, there's a 3 and 4, and we get a lot of experience. Like as a 4, I think Sharon too, probably we've already kind of hit our numbers for EMGs. So it's just getting more exposure this year and getting more experience. A lot of exposure to Botox. So we have to use all the different brands and kind of learn about the different nuances between them. Backlift and pump management. Dr. Smith, who's our program director, he does a lot of interventional spine, so we get early exposure with him. You'll get to do a spine rotation as a PGY2, so early exposure doing different procedures in the fluoro suite, as well as doing ultrasound-guided procedures to peripheral joints. So we have a whole dedicated ultrasound, MSK ultrasound curriculum. We do different workshops. You'll get exposed to some of those procedures are done under ultrasound, so like 10X, which is a percutaneous tenotomy treatment, as well as cryoneurolysis, which involves freezing of the nerves. A lot of those procedures are done under ultrasound, so we get exposure to those, as well as getting exposure to PRP clinic at the VA, as well as at KU. And then one of our community docs that we rotate with, he does some bone marrow aspirate concentrate and some regenerative medicine. So a lot of different exposure to different procedures in sports medicine, interventional spine, as well as neuro rehab with toxin injections and EMGs. Just a few quick pictures of some of our different residents doing some procedures in the last couple of years. You can see Vinny and Adam, a couple of our alumni, but they did some ultrasound workshops and then doing some other spine procedures. And that's Dr. Smith there on the left in the bottom left picture. And then one thing we want to touch on, just to let people know, I know that's a big question for a lot of medical students, but our call schedule, we are a home call program, so you'll be on call for 7 days. We have about 29 patients to round on the weekends. You'll see all 29 or so Saturday and Sunday each with your attending. Then you'll see anywhere from no consults to 4 consults per day on the weekend. And our call starts Friday evening and goes till the following Friday morning. And kind of goes in a level of seniority. So PGY2s will cover 7 weeks throughout the year, and then PGY3s will cover 4, and then PGY4s will just do 2 on their own, and then 1 buddy call with the PGY2, which I think is really helpful to kind of get your feet wet as a PGY2 to have a PGY4 there with you to kind of see how things run. But overall, I think it's very reasonable. It's not overly demanding. I think we all kind of share the load, and it's very, very reasonable. All right, so I'll turn it over to Sharon. And she'll kind of take us through the second half. Feel free to message us in the chat or let us know if you have any questions.
Perfect, thanks. So I'm going to start by going over some of our benefits. One of the big ones is we have health insurance as residents starting from day 1 that we start, which is great to have. You won't have any lapses in seeing your doctors that way. As residents, we also get a book and education stipend. Usually it's around $500, which is plenty for you to buy any of the books that you would need kind of throughout the year to keep up with your reading. In addition to your book stipend, we also get a conference stipend. That's usually around $1,000, which really helps when you're trying to go to these conferences and present your posters or abstracts. So it helps cover a lot of that travel costs. To kind of cover some of the days that you'd be using to go to these conferences, we do have 5 days of professional or admin days. That's great for fellowship interviews, conferences. In addition to that, we also have about 15 days of vacation, about 3 weeks. And then you get 10 days of sick day leave or sick leave. One of the big things I know as a med student, you're always wondering, are they going to feed you? And we do get paid $63 every 2 weeks, which goes a long way. And sometimes when you're not on campus at KU, you have a lot of that money left over, so you could just buy snacks or even a coffee mug if you wanted to. One of the good things about our program is that as a PGY4, they do pay for a board review. Sometimes those can get really pricey, so it's kind of nice to have. One of the other perks that we have at our program is that all of our professional memberships are paid for. So PM&R, AP, AANEM are some of the big ones. All of the other conferences or professional memberships sometimes can be covered through some of your education stipends as well. Next. So I know Logan had briefly mentioned some of our alumni. We wanted to list some of the other achievements that they've had. Our program has 100% board pass rate. And some of the fellowships, I know Dr. Smith had also mentioned, we offer the NAS Interventional Spine and MSK fellowship. A lot of our previous residents have gone on to have a NAS fellowship or ACGME pain. Some of them have gone on to sports med, peds, and even cancer rehab. Below are listed some of the programs that our alumni have matched to. Logan is actually going to Barrow Brain and Spine next year for his interventional spine. And I will actually be going to the Spine and Sports Center in Texas for my fellowship. Go to the next slide. This is just a picture of some of our more recent graduates and alumni. Up in the top right corner, you'll see Dr. Francio, one of founders, and then this bottom left corner is our most recent graduation with one of our previous NAS fellows who's actually staying on as faculty. Next slide, please. One of the big things about our residency is we really like to focus on overall wellness. So we do have a wellness committee that's in charge of making sure we welcome our newest PGY2s, that we're getting together as a big group and that we're all hanging out together. So those are just some of the examples. We recently had like a pickleball night and then just dinner and getting drinks after SAEs, which is nice, helps us bond and creates that cohesiveness. Next. And then talking about Kansas City in general, we're very centrally located in the US, which is great, especially for flying out. We have a brand new airport, tons of flights going in and out. We're close to a lot of the major cities like Dallas. We're actually about like an hour away, Detroit an hour and a half. So very easily accessible, I would say. Next slide. And then just going over life in Kansas, especially now with the economy, we all look at cost of living, and Kansas City has one of the best in the nation. And looking at traffic, we always worry about getting from site to site, and usually most of ours are very close together, very reasonable, about 15-20 minute drive between all our sites. Like I said, Kansas City is centrally located in the US, easy accessible with our international airport. And if you love food, this is definitely a foodie city. There's great, chefs that are here. Barbecue is definitely what we're known for. So tons of places for you guys to try. And of course, I can't not mention some of our sports teams. So the Chiefs, the reigning Super Bowl champs. We also have the Royals. And if you guys like soccer, we have the Sporting and the Current. The Current actually have a brand new stadium, which is great. And then of course, there's collegiate sports like KU, basketball, football, K-State, all of those. And in addition, Kansas City is actually one of the host cities for the 2026 World Cup. So definitely on the scene. very interesting for all the sports fans out there. I think this slide is just information about how to contact us, especially if you guys have questions or if you just want more information, definitely reach out to us. Check us out on our socials. We're definitely posting quite a bit. So yeah.
Awesome.
We'll
Yeah,
open it up for questions.
Yeah. We'll put our emails in the chat too. Just so people can reach out to us too if they want to. I think there's a couple questions I was going to get to. Let's see. Yeah, so I can talk about the research position. So it's a research track. So there's each one of each level, so PGY 4, 3, and a 2 that are in the research track. But basically you'll get linked up with a mentor, so you can kind of choose from one of the different mentors in our department, that whether to do neuro rehab or MSK or spine or peds or whatever your interests are. But you can kind of get lined up with a mentor, kind of develop a track or like a project that you want to do throughout your residency. And then we meet as a group. So the 3 of us residents plus Dr. Smith, and then a lot of the researchers in our department, our mentors, will meet roughly like once every 2 months or so. I'd say like at least once a quarter, or more often we'll do like a research track meeting where we'll all jump on a meeting. We'll kind of discuss and give updates on all of our projects and talk about where we're at and if we need any advice or questions or things like that, and kind of get some advice so we can keep our projects going. But yeah, the ideal thing is to kind of come up with a project as a BGY2, do it as a 3, do the actual project as a 3, and then like present and potentially publish and all those things kind of as a 4, but kind of a longitudinal process with a mentor. And like Dr. Smith said, you can get some funding and different things to kind of help. So yeah, it's a good experience. I've really enjoyed it so far. And I think, yeah, and Zach will be doing it as a PGY too. So I think it's only been good things.
I think there's also a question about scores, USMLE and COMLEX. I know Logan's from a DO program, so he can probably speak on COMLEX. I took the USMLE. We both applied, we both got in, so probably not really a preference in terms of that.
Yeah, I think for like, yeah, USMLE versus COMLEX, I had to ask Dr. Smith specifically, but I think very DO friendly programs, like we said, like I'm a DO, we have a lot of DOs in our program. And I think either one, I'd have to ask, but I think there might be some of our residents that only took COMLEX, but I need to double check on that. But there's not really any stigma or anything against DOs in our program.
I'm actually the only MD in my class. All the other 3 are DOs.
And then biggest draws for me was just kind of a good all around program. It kind of like good exposure to neuro rehab, good exposure to sports, spine. I think the early exposure, I think we have some outpatient rotations and stuff as a PGY too. So I really like that. Not just doing all inpatient, but getting exposure to kind of all the facets of PM&R as a PGY2 was something I really liked. And then just all the faculty I met were very approachable. And that's held true even as I've been here, just very approachable, very quick to teach, really willing to help out. I think those are one of the biggest draws for me. What about you, Sharon? You can kind of share too.
Yeah, I think one of the biggest things is obviously hearing about the program, whether you go to like one of our open houses, you get a feel for more of what our program offers. You get a feel for how the residents interact, which I think is a big draw too. That and geographically for me, I think it was great. So I think definitely the program offers quite a bit. And I think if it's offering everything that you're interested in and you like how everyone interacts, and I think that's kind of how you figure it out when you're applying.
Again, yeah, I'm not sure about the score cutoffs. Do you know, Sharon? I'm not sure. I don't think we have like hard cutoffs as far as I understand.
Yeah, I don't believe so either.
I think if you wanted to get maybe a better answer to that question, you can email our program coordinator and they might be able to help out with that.
And we can throw her email in the chat here in a second. I can look that up and send it out to you guys. But yeah, like I just want to echo what kind of Sharon was saying, but Kansas City, I never lived here before. I'm from actually out west, so kind of missing the mountains, but other than the mountains, I think Kansas City has everything you want. Like she was saying, the food's excellent, a lot of cool things to do, sporting events. You can kind of find a lot of good art scene too. People go to different concerts and art museums, a lot of things to check out. And the city has a lot to offer. I think it's kind of underrated. Not many people know a whole lot about it, but yeah, I really enjoyed living here.
Yeah, it's a hidden gem, definitely. So I did include Logan and I's emails in the chat, as well as Sarah, who's our coordinator. So definitely feel free to reach out with any further questions.
Yeah, definitely reach out on social media too. We're pretty active. We try to post different photos and stuff or videos on our social media about different events we're doing for didactics or resident outings or updates on different people in the program. So definitely try to follow us. We try to be pretty interactive and kind of share things on there too. Awesome.
You guys have like 30 seconds, so if you want to call it or whatever you want to do.
I think that might be it. Thanks, guys, for listening to us.
Yeah, don't hesitate to reach out. Thanks for having us, Zach. Zach's the man. He's killing it already as a PGY too. So we're excited to have him. So thanks to PM&R Scholars. Keep up the good work. And yeah, let us know if you guys have any questions.
Thank you guys so much.
That last question. So like I said, just keep an eye on our socials. We'll post whenever we have an open house, and that way you guys can hear more about it. All right. Thanks, guys.
Thank you guys so much.